Good afternoon, and thanks for joining us for Living Local, your lifestyle show for all things Charleston and beyond. I'm Ashley Meservey. Joining us today, we have Dr. Julie Tabor. She's a radiologist here at East Cooper Medical Center. But today we're talking about breast imaging as a part of your radiology. But first off, thanks for being here with us.
You're welcome. It's good to be here. Thanks.
Okay, before we get into all the exciting news with the technology and whatnot, first off, let's just talk about you and give us a quick little background of where you come from and what you do here.
Well, I did my training at Duke in North Carolina. I did my breast fellowship there. I've been in practice for about 25 years with doing breast imaging and general radiology. And we started here several weeks ago and are excited to be here.
Okay, so, and you have background in this, obviously, 20-something years in this particular field. We're talking about the technology and everything, all the exciting news you have about that. Has it really evolved over the years? Have now more than ever, are we able to see what we...
Absolutely. When I started, we had the old type film screen, which changed to digital mammography, which changed to 3D mammography, which is what we do now as standard here at East Cooper. And it is, it's a much better way to image the breasts. It's a great way to store imaging. It's a great way to change the images and look at all facets of the breast tissue even more closely than we could before.
So in your experience, have you been able to detect things that before you would have had to wait until they progressed?
Yes,
further?
Absolutely. You can see very small areas. And the way the 3D mammography works is it takes multiple images and then stacks them on top of each other. So when we look at them on the viewer, we scan through each part of the breast, like layers. Okay. Yes. So you're looking at this layer and this layer, and that. So you can imagine that in the middle of the breast, if you've got an abnormality, it's going to be covered by overlying tissue above and below if you're doing just the standard 2D type of imaging. But as we go through, we can see each section and pick out very small abnormalities.
So would you be able to detect something that could be stage 1 before? I mean, this is just me going out on a limb here, before it progresses much further.
Yes.
And let's just give a quick note why it's important to sit here and get these images and to it usually, is it 40 that you start getting?
So there's different screening protocols, but we typically go with the American College of Radiology, which is also, I think, the ACOG, which is the American College of OBGYN, where you start at between age 35 and 40 for your screening mammogram, and then typically you do it yearly until age 75 or 80, or when you reach the point that you have enough medical issues that your quality of life has really deteriorated and you're not going to live for more than 10 years beyond the point. But if you still have 10 good years to live, then screening mammography should be continued.
And I'm 37 and I have it running in my family, so I've started getting are you finding that a lot of people are younger getting it?
Yes, absolutely. And the good thing now is there are a lot of screening tools to see how high risk you are, and if you qualify as a high risk person, which is someone who has an increased risk of up to 22 to 25% over the baseline, there's other screening modalities like breast MRI that we can use to really evaluate the breast better.
So how has it changed your perspective? I mean, as a physician, a radiologist, I mean, now having these tools unlike ever before, I bet it's pretty exciting.
It is exciting. I mean, I think as radiologists, we see a lot of cases that could have been found earlier with the right tools, and as the technology has developed, it's really getting more like that. So the unfortunate thing about breast cancer is we don't know what causes it. We have some ideas, but there's no way to stop it before it develops. So your best chance of doing well if you develop breast cancer is finding it early so that it can be treated early and appropriately. So these tools all allow us just to find it earlier and earlier.
Okay, and I find you fascinating, so I'm asking one more question before we talk about making an appointment and all of that. But I normally see like radiologists, they're kind of behind the scenes, but how do you work with the doctors and things?
So actually that's one really nice thing about breast radiology is that we do have a lot of interaction with the patients.
Most of the people, I was like, you've got a great personality.
Well, thank you.
Yeah.
So most of us do who work with patients. And part of the reason we choose breast radiology is that we are comfortable working with patients. We find it interesting. We think it's important to educate women about breast care and the appropriate tools, and also to look at each patient as they come through is a different person. And we're all comfortable with talking to patients about screening, about diagnosis, about what the next steps are. So most of us are very comfortable talking with patients and interacting with patients.
Not that the radiologists out there, by the way, are not comfortable.
Right. But this is part of what we do. We like to be involved with the patients. We like to talk to patients and explain what we're doing.
Well, I feel like I could talk to you all day, though. I'm like, I gotta know. So anyway, but before we head out, let's just talk about making an appointment and things like that. How do we come see you?
Just call up East Cooper.
Yeah.
Make an appointment.
Go online. Look
right.
at
Go
that.
online. Yes. With screening, you need a physician referral.
Okay, gotcha.
But most of the time they let you make your appointments. You just have to give them a physician's name.
And of course, with your health insurance and stuff like that,
yes.
A lot of times you just have to look that up. So.
Yes, exactly.
All right, perfect. Well, thank you so much again for joining us today.
You're welcome.
We learned a lot. And of course, you can always head online for more information, eastcoopermedctr.com.